Welcome to the deep dive. Today we're getting into something that causes a lot of head scratching for dog owners.
Mhm.
And honestly, it can be pretty frustrating too, that involuntary urination dogs sometimes do, and when they get super excited or maybe a bit nervous.
Yeah, it's a tricky one. We've been digging into a load of veterinary and behavior sources specifically on this.
Right. And our goal here is to sort of pull out the really key stuff, what's actually going on with these behaviors, why they happen.
How to tell them apart, which is important.
Definitely. And that absolutely vital first step you have to take before you even think about behavior modification.
hmm And then what the sources say are the best positive ways to manage it, without punishment.
Because it's so often mistaken for defiance, isn't it?
Exactly. But understanding the real triggers, the emotional drivers,
Yeah.
that can really shift how you deal with it.
Okay, let's dive in.
So first off, the sources really emphasize that while we often talk about submissive and excitement urination together,
Right.
they actually come from very different emotional states. The end result might look similar, unexpected pee, but the why is different.
And crucially, they're involuntary.
That's the core message, yeah, involuntary. The dog isn't choosing to do this. They're losing control because the emotion, whether it's fear or excitement, is just overwhelming in that moment.
Okay, that's a massive point to start with. So let's break down submissive urination first. What's the emotion driving that?
Fear, anxiety, appeasement. Basically, the dog feels threatened or intimidated.
Ah, so it's a signal.
Precisely. It's like they're saying, hey, I'm small, I'm no threat, please don't escalate things. It's an attempt to diffuse what they perceive as a tense situation.
So the triggers are often things like people looming over them, or maybe being told off.
Exactly. The sources list things like greetings, especially if the dog's a bit timid or has been corrected in the past. Also, someone standing directly over them, uh, making strong eye contact, reaching over their head.
Stuff we might do without thinking.
Right. Even being picked up if they're not keen on it. Loud noises, scolding, anything that feels intimidating to that particular dog.
And the body language kind of screams, I'm worried, right?
Totally. The sources are clear on this. You'll see other submissive signals happening at the same time, like crouching really low.
Tail tucked right under.
Yeah, tail tucked, ears flat back, avoiding eye contact, maybe licking their lips nervously, or that sort of forced-looking submissive grin,
Mm.
sometimes trembling too. And the urination itself is usually, a smaller amount, released without any warning or posture. The dog might even seem surprised it happened.
Okay. Fear, anxiety, trying to appease. Got it. Now contrast that with the excitement kind, the happy pee.
This one's all about, well, just sheer over-the-top excitement. Pure joy, really.
Like they just can't contain themselves?
Exactly. The emotional surge is so intense it just, like, overrides their bladder control for a second.
The classic example being when the owner comes home.
That's the big one mentioned in the sources, yeah. Owner returns, especially after being gone a while.
Hmm.
But also really rough and tumble play sessions, meeting new, exciting people, just generally high stimulation events.
And the body language there is completely different.
Oh, yeah, night and day. You see intense, happy excitement. We're talking full body wags, jumping, maybe some excited whining or yipping, frantic, happy movements. It's generally a dog who's clearly thrilled, just overflowing.
And the urination, similar in amount?
Usually, yeah, small to moderate amount again, totally involuntary. Just sort of happens right at the peak of that excitement burst. They're wiggling or jumping,
Yeah.
and out it comes. No deliberate act.
It's fascinating, isn't it? Same
Mhm.
result, pee on the floor, but totally different reasons behind it.
It really is. And the sources do mention sometimes you get a kind of mix,
Oh,
particularly during greetings. A dog might rush up, tail wagging like mad, clearly excited, but also maybe keep their body a bit low, showing a little uncertainty. They call that conflict-induced urination. A bit of both emotions happening.
interesting. Okay, so we understand the difference now. But before anyone tries behavioral fixes, the sources were really, really clear on something else.
Absolutely non-negotiable first step. This came up again and again.
Which is?
You have to rule out medical causes first.
Mm.
Always. There are so many health issues that can cause inappropriate urination, and they can look just like these behavioral types.
Right. So what sort of medical conditions are we talking about? What should people be aware of?
Well, the sources list quite a few. Urinary tract infections, or UTIs, are a big one. They cause urgency in accidents.
Okay.
Then there are different kinds of incontinence where they leak urine without realizing it. Bladder problems like stones or crystals.
Ouch.
Yeah. Bigger systemic diseases too, like diabetes or Cushing's disease, which affect thirst and urination. In older dogs, cognitive dysfunction, sort of like doggy dementia, can lead to house training issues
Wow.
and even physical pain, like arthritis. If it hurts to squat outside, they might just go inside instead.
That's a much longer list than I might have guessed. So it's definitely not something you can just assume is behavioral.
Definitely not. You need that vet check.
So what does that vet check typically involve, according to the sources? How do they figure it out?
It starts with a really thorough history from you, the owner.
Details matter.
Hugely. The vet needs to know the dog's age, breed, when it started, how often it happens, the exact context. Is it always when your tall uncle visits? Only when you raise your voice?
Connecting it back to those triggers.
Exactly. And what does the dog look like when it happens? Body language? Is it a puddle or just a dribble? Do they try to posture? What's their normal toilet routine? Any changes at home? Diet? Water intake? Any previous health issues? All that detail is crucial.
Okay, so owner observation is key. Then what?
Then a full physical exam, checking everything over. And diagnostic tests are usually essential.
Like blood tests, urine tests.
Yep. The sources really highlight urinalysis, looking at the urine itself for infection, inflammation, crystals, things like that.
Makes sense.
And crucially, if they suspect an infection, a urine culture and sensitivity test, that tells them exactly what bacteria it is, if any, and which antibiotics will actually work against it.
Okay.
Plus, standard blood work, CBC, and chemistry panel to check organ function, look for signs of diabetes, kidney issues, all that systemic stuff we mentioned.
So basically checking the plumbing and the whole system that supports it.
That's a good way to put it, yeah.
Right.
And sometimes, if those tests are normal, but the vet still suspects something medical, they might need to do more, like x-rays or an ultrasound of the bladder or other specific tests. It's a systematic process.
Right. Okay, so let's fast forward. Vet's done the workup. Everything checks out medically. It is behavioral. Now what? What do the sources say is the best approach?
The main themes running through all the sources are positive reinforcement, managing and reducing the triggers, absolutely no punishment, and building the dog's overall confidence.
Okay, let's unpack the punishment part first. Why is that so strongly advised against? It seems like a natural reaction for some owners when they find a puddle.
It might feel natural, but the sources are unanimous.
Yeah.
It's the worst thing you can do.
Why?
Because for a dog peeing out of submission or fear, punishment just confirms their fear. It makes them more scared, more anxious, and therefore more likely to pee submissively next time.
Oh, wow. So it backfires completely.
Totally. And for the excited dog, punishment is just confusing.
Yeah.
They're being happy, greeting you, and then they get yelled at for something they couldn't control. It can create anxiety around greetings, potentially even turning that excitement pee into the conflict type we mentioned earlier.
Because it's involuntary. They can't help it.
Exactly. Punishing an involuntary reflex is unfair and just damages your relationship with your dog.
Okay. Message received. No punishment. So what should people do? Are there general strategies that work for both types?
Yes, a few key things. First, clean up any accidents really well. The sources stress using an enzymatic cleaner.
Not just regular soap.
No, because regular cleaners might smell clean to us, but they don't break down the specific urine molecules dogs can smell. Enzymatic cleaners do, which stops the dog being attracted back to that same spot.
Good tip. What else?
Manage the bladder. Take the dog out for a potty break right before situations you know are likely triggers. Guests coming over, playtime starting. Go outside first. And empty your bladder means less chance of an accident.
Proactive management.
Yep. And consistency is vital.
Yep.
Everyone in the house, any regular visitors, they all need to be on board with the same management plan.
Okay. Now let's get specific. For the submissive dog, how do I make them feel less threatened?
It's about changing our body language and approach. The sources suggest avoiding looming over them. Get down low squat, sit on the floor.
Less intimidating.
Much less. Avoid direct, hard stares. Soften your gaze. Look slightly away. Approach from the side, not straight on. Don't reach over their head to pat them. Offer scratches under the chin or on the chest instead.
Simple changes.
Simple, but effective. Use a calm, soft voice. Avoid sudden movements. And, importantly, let the dog initiate contact. Don't force interaction. Let them approach you when they feel comfortable.
And greetings. That seems like a peak trigger time.
It often is. So, for submissive dogs, keep greetings super low-key. When you come home or guests arrive, just ignore the dog for the first 5 minutes or so.
Really? Just ignore them?
Yeah, just go about your business calmly. Let the initial anxiety settle. Then, once the dog seems calmer, offer a quiet, gentle greeting, remembering all those non-threatening body language tips. Having guests greet the dog outside first can also help dissipate that initial tension. And building their general confidence is huge for these dogs.
How do you do that?
Positive reinforcement training is great. Learning commands, getting rewarded for success that builds confidence. Gently and positively exposing them to new things, pairing novelty with rewards, helps them feel safer overall. Avoid situations stress them out, especially early on. Some sources also mention crate training, providing a safe den, can help reduce general anxiety.
What about redirecting them if you see the signs starting?
Yes, good point. If you see your dog starting to crouch or look anxious, calmly ask for a simple behavior they know well, like sit or down. Something incompatible with peeing. Then reward them generously for doing it. It shifts their focus.
Okay, that makes sense for submissive types. Now, for excitement urination, the goal isn't reducing fear, it's just turning down the volume on the excitement.
Exactly. You want to manage the level of arousal. So again, low-key greetings are key.
Same strategy, ignore them initially.
Pretty much. Walk in calmly. Maybe put your bags down, take your coat off. Ignore the bouncing, wiggling dog for maybe 5, even 10 minutes until they start to settle.
Hard to do sometimes.
It is, but crucial. Tell visitors to do the same, no big fuss right away. Keep your own energy calm. Avoid that high-pitched, who's a good boy voice, and direct eye contact until they've calmed down. And again, greeting outside is often easier.
And teaching calm behaviors.
Yes. Actively teach and heavily reward calm behaviors, especially around trigger times like greetings. Teach a solid sit or down for when people arrive, and reward them for holding it calmly. Some sources mention specific relaxation protocols like Dr. Karen Overalls, which are structured ways to teach a dog to relax on cue.
So teaching an alternative, calm response.
Right. And like with the submissive dogs, redirecting that excited energy into a known calm cue like sit can help interrupt the cycle. Oh, and a predictable house training schedule helps everyone, really. It builds good habits and can reduce anxiety just through routine.
Now, you mentioned medication briefly earlier. Did the sources say much about that?
They mentioned it as a possibility, yes, but with some important caveats.
Like what?
It's never the first step and never a standalone fix. It's only considered under veterinary guidance as an adjunct and add-on to behavior modification.
So helping things along while the training happens.
Potentially, yeah. In specific cases, maybe to help with bladder sphincter control while the behavioral strategies start to work, or if there's a really significant underlying anxiety issue. But it's absolutely a decision for the vet, working alongside the behavior plan, not something an owner should just ask for.
Got it. So looking at the bigger picture, what's the prognosis? Can dogs actually grow out of this or overcome it?
Generally, yes. The outlook is pretty positive according to these sources.
Yeah.
Especially for puppies under about 6 or 7 months.
They just mature.
Often, yeah. As their bladder control physically matures and they gain a bit more confidence and learn how to manage their excitement, they frequently grow out of it, especially if the owners manage things well early on. For adult dogs, the sources say significant improvement, even complete resolution, is definitely achievable.
But it takes work.
It takes patience, consistency, and sticking to those positive, non-punitive strategies. But yeah, the prognosis is generally good if owners commit to the plan.
What if someone tries all this and it's just not working?
Then the advice is clear. Seek more specialized help. If the problem persists, or if there's severe fear or anxiety involved, the next step is a referral to a board-certified veterinary behaviorist.
A specialist.
Exactly. They have advanced training to really dig into complex cases, develop very specific plans, and they can appropriately integrate medication if it's truly needed as part of that comprehensive approach.
So boiling it all down, what are the absolute key takeaways for listeners dealing with this?
Number 1, medical rule out first, non-negotiable.
Right.
Number 2, understand it's involuntary. It's emotion spilling over, not bad behavior or defiance.
Crucial mindset shift.
Absolutely. Which leads to number 3, no punishment. It makes things worse. Focus on positive reinforcement, managing triggers, and patiently building confidence.
And consistency.
And consistency. And finally, don't be afraid to ask for professional help from your vet or a behaviorist if you're stuck.
It really does change everything when you shift from thinking my dog is being bad to my dog is feeling overwhelmed.
It changes the whole dynamic, your approach, everything. It builds trust instead of fear.
So to recap, we've distinguished between submissive urination driven by fear appeasement and excitement urination driven by overarousal. We've hammered home the absolute need for a vet check first. And we've explored those positive management strategies focusing on triggers, body language, and building confidence.
Yeah, seeing it as a physical manifestation of an intense, involuntary emotion is really the key insight.
Which brings us to our final thought for you to ponder. How does recognizing the involuntary, emotion driven nature of this specific behavior in dogs make us rethink other animal behaviors we might find annoying or problematic? If we start looking more through the lens of emotional state rather than assuming deliberate intent, how might that change the way we interact with, train, or simply live alongside the animals in our lives? Thanks for joining us for this deep dive.